Question number 30 is a diagnosis of polycystic ovary syndrome requires the presence of which of the following clinical features? One is menstrual irregularity, second is clinical or biochemical androgen excess, third is multiple cysts in the ovary, and fourth is a BMI less than 18.5 kg per meter square. So currently, for diagnosis of polycystic ovary syndrome, we follow revised Rotterdam criteria. Revised Rotterdam criteria. So in the revised Rotterdam criteria, is there menstrual irregularity? Yes. There can be oligomenorrhea or amenorrhea. There is clinical or biochemical androgen excess. Yes, clinically androgen excess like hirsutism, male pattern baldness, etc. comes, or there can be biochemical androgen excess. So second is also correct. Third is multiple cysts in the ovary. This is correct. BMI less than 18.5 kilogram per meter square. No. So answer will be 1, 2 and 3. A 1, 2, 3 will be the option. So if coming to the Rotterdam criteria, so as to diagnosis. So what is revised Rotterdam criteria? It is to diagnose polycystic ovary syndrome in adults. Background is it is on the basis of the 2003 Rotterdam criteria, and it is currently most widely used diagnostic criteria. In this criteria, there are 3 criteria given, and out of these, any 2 should be present. So if any 2 are present, you are going to label the patient as polycystic ovary syndrome patient. So first is oligomenorrhea or anovulation. Oligomenorrhea and anovulation. What is oligomenorrhea? Oligomenorrhea means cycle length is more than 35 days. Or there should be amenorrhea. So out of these 1, 2. So out of these 1, 2, any menstrual. So this comes under menstrual irregularity. So there is menstrual irregularity. So oligomenorrhea, cycle length more than 35 days, or amenorrhea. But there is a patient who is uncertain about her menstrual history. Then you can go for the biochemical evidence of anovulation, and that is mid-luteal progesterone is low. You are going to go for the mid-luteal progesterone level, and if it comes out to be low, then it means that the female is suffering from oligomenorrhea. So first is oligomenorrhea. Second is clinical and or biochemical signs of hyperandrogenism. So what are the clinical signs? One is hirsutism, second is acne, third is androgenic alopecia, etc. Then biochemical. In biochemical, you can go for raised total or free testosterone or other androgens, that are the male hormones. So if the male hormones are increased, you find out about it through biochemically or clinically. This is the second criteria which is met. Now third is polycystic ovaries on ultrasound. So what are polycystic ovaries on ultrasound? So if any one of the ovary, anyone, both can also show, but if any one of the ovary is showing more than equal to 12 follicles which measures 2 to 9 millimeter in diameter, it means you are going to label it as polycystic ovary. Or if there is increased ovarian volume more than 10 centimeter cube in one or both ovaries, so either of the ovary is more than 10 centimeter cube, it means that's a polycystic ovary. So what is polycystic ovary? It means more than equal to either 12 follicles. Each should measure from 2 to 9 millimeter in any of the ovary, or if there is increased ovarian volume more than 10 centimeter cube. With increased ultrasound technologies, more advanced technologies coming, this level of threshold is increasing. Because they are now going to see more follicles, so that's why the threshold is increasing. But currently the Rotterdam criteria, as per Rotterdam criteria, it is more than equal to 12 follicles. So in the ultrasound appearance, normal ovaries will be having the follicles not more than 12, and the size will be smaller. But in polycystic ovary, there should be multiple small follicles, 2 to 9 millimeter. This is. So you are going to diagnose the patient as polycystic ovary syndrome if any of the 2 criteria are met. So once out of these 3 criteria, 2 are present, you are going to label the patient as polycystic ovary syndrome. But before labeling polycystic ovary syndrome, you need to exclude other causes too. And what are these other causes? The one is pregnancy. Second, thyroid dysfunction. Third is hyperprolactinemia. You need to see if the prolactin level is high or not in this patient. Then non-classical congenital adrenal hyperplasia, CAH. Then Cushing syndrome. and then androgen secreting tumor. Once these have been ruled out, you have excluded them, and you saw that out of these three, two are present, any two criteria are present, then you are going to label the patient as suffering from the polycystic ovary syndrome as per the revised Rotterdam criteria. If you're not able to remember it now, you can see the patient information sheet, which is in very easy language as to how to diagnose PCOS. So diagnosis criteria is: a diagnosis of PCOS can usually be made if other rare causes of the same symptoms have been ruled out. What are the other rare causes? We have talked about this can be pregnancy, this can be Cushing syndrome, this can be non-classical congenital adrenal hyperplasia, this can be androgen secreting tumors, etc. And you meet at least two of the following three criteria. What is the first criteria? That you have irregular periods or infrequent periods. This indicates that your ovaries do not regularly release eggs or ovulate. So this comes under the first topic, menstrual abnormality, that is oligomenorrhea or amenorrhea. Second is the blood test, showing you have high levels of male hormones such as testosterone, or sometimes just the signs of excess male hormones, even if the blood test is normal. So what are the signs of the excess male hormone? Like hirsutism, like acne, like androgenital alopecia, etc. So this comes on the topic second, chemical or clinical, biochemical or clinical signs of excess androgen. Then third is scan showing that you have polycystic ovaries, which we have diagnosed, which we have talked about, that either the size or the number of follicles. So as only two of these needs to be present to diagnose PCOS, you will not necessarily need to have an ultrasound scan before the condition can be confirmed. So sometimes even ultrasound is not required if these two criteria, that is, one is the menstrual abnormality and second is the biochemical or clinical signs of excess androgen is present. So coming to our question again, a diagnosis of polycystic ovary syndrome requires the presence of which of the following clinical features? Number one, menstrual irregularity, yes. Clinical or biochemical androgen excess, yes. Multiple cysts in the ovaries, yes. BMI less than 18.5 kg per ton, no. This is not the diagnostic criteria.